Follow along a typical surgery day with us. Good morning and welcome to Animal Care Centers. We have an office in Landing and one in Flanders, New Jersey. Welcome to the reception area. Here's our whiteboard with all of today's visitors. You'll be greeted by a friendly receptionist, who will then go over your estimate in detail and answer any questions that you might have. When signing your estimate, we ask that you leave a phone number so the doctor can reach you when the procedure is completed. Here is Stormy. She's getting a spay today and a gastropexy. Stormy's a Great Dane puppy. She's healthy and she's undergone pre-surgical blood work. Today's surgical technician is Emily. She'll review the type of procedure, any food or medication allergies, and takes a complete health history. Consistency is key. Emily will stay with Stormy from morning until evening.
Hi, I'm Emily, one of the surgical technicians here at Animal Care Centers, and I will be Stormy's nurse today. Today we are just making sure that the machine is all set up, safe, and ready to go. All the monitors are working, it's filled with our ISO, which helps maintain the anesthesia through the procedure. And to make sure we have the proper reservoir bag, everything looks set to go. It looks like all the leads are hooked up, the pulse ox, the EKG, everything we need possible to keep Stormy safe. We also have this nice heated table here to help maintain her temperature throughout the procedure.
Hi, I'm Dr. Chris Hallahan. I will be performing Stormy's surgery today. Today, Stormy's getting a spay gastropexy, which is, as most people know, spay is to remove her ovaries and uterus, so we don't have to worry about pregnancy and issues that unspayed dogs, such as cancer of the ovaries and uterus and unwanted pregnancies, infections of the uterus, are totally avoided by having them spayed. And a gastropexy is where we're going to actually tack her stomach to the side of her body wall inside so that it can't flip, because she is a breed who is predisposed to a condition known as gastric dilatation or volvulus, or bloat as most people know it, where it can be common in large breeds like Great Danes, German Shepherds, Labradors, any large deep-chested dogs, where the stomach after time, because it stretches the ligaments, can flip, then it bloats with gas and can be fatal. So this prophylactic procedure stops it from being able to flip. So we're going to be pre-oping her in just a second, and then surgery in about an hour.
So Miss Stormy just received her pre-op induction. Keeps her calm when we put the IV catheter in, and also helps with pain management. We are a fear-free certified practice, so we like to keep the animals as calm as possible and make their experiences fear-free as possible. Her temperature, her pulse rate, and her respiration rate. As you can see right here, this is what these numbers mean, a TPR. And we also do a post-op laser therapy treatment, which we do recommend because it promotes blood flow and healing to the area of the incision. This patient's parents decided to choose a onesie to go home, which is fabulous, but we also have the option of the traditional cone. So this is our surgical preparation area. As you can see, we have all our supplies ready that we could need. Everything for an IV catheter, everything ready to intubate, and once again, our anesthesia machine is here and ready to go. I have triple checked it to make sure everything is working properly. We also here have our pre-operative antibiotics that we're going to be administering today to prevent the risk of infection. This is our surgical monitoring sheet we have for each patient. It is customized to meet their individual needs. We're just going to go out for a quick potty break before our surgical procedure. Come on, Stormy. So now we're getting ready to put the IV catheter in. First, we shave a little area for just like this, but we get them used to the clippers first because it can be a little scary. Cookies for me. It's okay, baby. See?
Good girl.
Just a little noise. Yeah, good baby. So just a few gentle scrubs to make sure we're getting the area nice and clean. We are getting ready to induce her with our drugs. Each of our drugs is labeled, so there is no room for error, so we know which each one is. Once we induce her, we will then intubate her. This is what we use for intubation, and it's based on animal size. So she's a big girl, so she's gonna get a big tube. I'm lubing her eyes.
I just gave her what they call a line block. It's a numbing agent along where my incision is going to be, so that it makes her less painful during recovery. So I just instilled that under her skin, and now we're going to shave her and prep her for surgery.
So right now I am setting the IV pump with the rate of fluids for this patient, the size of the patient, and the amount to be administered. So right now we have a pulse ox on her to tell us her oxygen saturation level as well as her heart rate for the beginning of the procedure. And now I will push the IV drugs. Slowly, of course. Every patient, when they come in for surgery, they get a mani-pedi. Now that we have moved our patient into surgery, you'll notice I'm wearing a little bit of a funny outfit. Here's my surgical bouffant, my mask, and of course my booties to keep everyone safe. And you'll also know my friend has booties on too to prevent heat loss during surgery. This helps keep our patients extra warm.
Bombos.
So now I'm scrubbing in for surgery for Stormy. She's all prepped and ready to go. So I have to do this when I prep. I have to completely maintain a sterile environment. And somebody's got to help me get tied in after I scrub and gown and glove. And my fully trained surgical technicians are all set in surgery for me to get started. I'm all ready to go. We're going to rock and roll and get this surgery done. So Emily just opened my pack up. Staying in a sterile environment, nothing can get touched on that. And like I said, it's super important. We have very awesome technicians here who are fully trained, and they are so important for monitoring. You can hear the EKG machine behind me, so we're monitoring every moment of surgery. We're ready to get started, and we'll all talk to you when we're all done.
A phone call to Stormy's parents lets them know that she did beautifully during surgery. Medications to go home are filled, and a customized discharge sheet is created. Constant monitoring continues as Stormy wakes up in her heated recovery kennel.
Sometimes after surgery they're a little wobbly, but she's very excited to see her mommy and daddy, I'm sure. Come on, let's go. Who's there? Who's there? Who's there? Oh, there's the tail. She's a little wobbly.
Emily's going over the customized discharge instructions with the client, answering any questions they might have about when to start medications, food, and exercise. Stormy looks very nice in the lilac onesie, don't you think? This is the evening of her surgery. Resting comfortably at home. Here's a review from Stormy's family. We sure had fun making this video for you. We hope that you enjoyed following along. Thanks for watching from everyone at the Animal Care Center's team. Facebook.com/ACC Flanders and our website www.animalcarectrs.com.